Okay, so had the baby, went through 2020, the year of the nurse. It was insane. The hospital was insane. My job was insane. My baby's adorable. She's 19 months now, and I love her so much, and it was so worth it. We decided to go for number two. So, um, got my IUD out February 9th of 2021, shortly after I turned 38, so I'm a little nervous about trying to conceive at such a late age, but I know a lot of women do it successfully, so I decided to go for it. And I really want a sibling for Alice because she's so adorable, and I think she'd be such a good big sister. Got my idea, started my period right away, ovulated day like 14, so we did the deed multiple times. Pretty good shot, I think, other than fresh Mirena IUD removal. I don't know how that affects fertility. My OB says it doesn't affect fertility at all, but she also multiple times told me that it doesn't cause weight gain. And as soon as she pulled that sucker out, like 3 weeks, I lost 10 pounds. So I'm not entirely sure that what she thinks about the Mirena IUD is true. I haven't had any pregnancy symptoms. I'm like post-ovulation day 7 today. I've had some vivid dreams. That could just be my psyche because I'm obviously thinking about pregnancy a lot. Oh, and I had this little dying lady, patient, like in her 90s, say to me, "Do you have a baby?" And like just creepy, like almost fortune teller look in her eyes. And I was like, maybe? And that was like post-ovulation day 5. So those are my only pregnancy symptoms so far. A psychic and vivid dreams. And my dreams are crazy. I don't remember them being this crazy with my first pregnancy, but they're so vivid, and they like not repeat, but they continue. Like I'll wake up and I'll be like, that was bizarre, and I'll sit and think about it, and I'll fall back asleep, and that dream will continue on into the next sleep. It's almost like I'm in another reality when I'm sleeping. So either I've totally lost my marbles or I'm pregnant. So hope for the latter. Alice is asleep right now, and she's doing so well. She's a good sleeper. Sometimes I'm thinking about getting the SNU if we do have another baby, because that newborn stage was absolutely terrible, and I just don't know how I can do that again with a toddler, because she still occasionally wakes up in the middle of the night and needs me, and I just don't know like how you attend to a toddler and a newborn with a C-section scar, which I'm probably going to get another C-section. I don't think I ever put that in my update, but Alice was breech until 39 weeks, so I opted for a C-section, and they took her a week early. The C-section went beautifully. They gave me a tiny bit of morphine in my spinal block, and I was euphoric and happy. I only took like ibuprofen and Tylenol the rest of the recovery because it just healed well. I have like almost no scar. It went very well first time around. So my OB is retiring though, so I would have to get a different OB for my second C-section, which makes me a little nervous because my OB was really experienced in C-sections and just amazing and to the point and exactly everything I want in a doctor. But she recommended some really good ones that she trusts, and she said, she learned from some of them, like C-section wise, so I will try to get on their, whatever it's called, their plan, their team, under their care, if I get pregnant again. So I can take a pregnancy test. I think I'm post-ovulation day 7, so I want to wait until at least like 9 and then just start taking them every day there on after. And my last pregnancy, I ovulated day 14. I had the implantation cramping on ovulation day 10, and I tested positive for pregnancy on day 12. So kind of thinking maybe it'll be similar this time, and I definitely don't want to test too early, because looking at a negative pregnancy test, we all know, is one of the most depressing things you can do with your life. So, no, I'm sure there's worse things. But I'm really excited. I've got positive feelings about my health. I am overweight since having Alice. I started at like 150 and now I'm like 165, I think. So my OB was like, you should try and lose some weight before you conceive. And I'm like, I turned 38. I don't have time. And she said, yeah, I agree. You should get on it. So I'm just going to go for it, even though I'm slightly overweight. And I know that can increase some risks, but I feel really good about this. I'm strong. I'm like financially stable. Alice is wonderful. My husband's wonderful. So I'm really excited about it. I guess send baby dust my way, and thanks for watching. Okay, so a lot has happened since my last update. I did test for pregnancy pretty early, post ovulation day 8, and it came back positive. So I was pretty stoked. And then we flew out to Utah like a week later, so I was like barely 4 weeks pregnant. And while we were out there, I started having some bleeding. So I called my OB. I am Rh negative and my husband's Rh positive. So she's like, go to the ED, you've got to get a RhoGAM shot. Went to the ED out in Utah, got a RhoGAM shot. They did an ultrasound. They said that it was a uterine pregnancy, but it was like lower down in my abdomen. So that was kind of concerning, like I was miscarrying. Bleeding continued for another week. My OB was running serial HCGs, which were increasing, but not doubling every 48 hours. So that's also concerning. So I just got another ultrasound today, and what's today, March 22nd? I got my RhoGAM shot March 15th. So I'm like 6 weeks pregnant now. They did see a heartbeat, which was great, but they saw like this huge clot in my uterus, like 20 times the size of, probably even more. Like the embryo was this little teeny tiny thing, and then the clot was like this big. It was huge. So subchorionic hematoma. Reading some stuff online, I guess it's fairly common, and a lot of pregnancies are fine after it. But they said that my embryo was really low in the uterus, and the embryonic sac was like smashed or something, like oblong. So that wasn't a good sign. They said probably a 50-50 chance that I'll miscarry or keep the pregnancy. The doctor did kind of suggest my age could have contributed, or a chromosomal abnormality could have contributed, or just by chance. He really didn't really know all of the above. So it's stressful. I just wish it would either go or stay, not this like in between. I have been having bleeding for over a week now. Clots in it. You know, they keep saying you're gonna pass tissue. I'm like, already done that. So I don't know when you know that you actually miscarried. The doctor today said that you would see like tons of blood. He said 3 times this amount of blood as your normal period, and a lot of clots. And then you'll know you probably miscarried and the embryo is gone. But he didn't sound very promising that it's going to stick around anyway. And if I do miscarry this pregnancy, then I'm going to have to wait another 2 months before we can start trying again. So, got another ultrasound next week, and then one scheduled for the week after that. So they're going to do ultrasounds like every week for the next few weeks. Make sure the baby's growing, make sure it's okay. Otherwise, if it's not growing, they're going to give me some progesterone pill that will allow it to pass more quickly, make sure that everything is evacuated from the uterus. That will avoid any kind of surgical intervention, which I really don't want to do a surgical intervention. So, pretty stressful. I mean, obviously I hope it stays, but I hope it stays as a healthy pregnancy, not as like a chromosomal abnormality pregnancy that just barely hangs on. I'd rather it go if it does have a chromosomal abnormality. So, pregnancy is not easy. Trying to conceive is not easy. There's these ups and down roller coaster of emotions and test results. And I told a couple people in my family that I was pregnant, and then the bleeding started, and so I just stopped telling people. So like half my family knows and half my family doesn't know, and a lot of my friends know because they've been a huge support for me through all of this. But it's just so frustrating. I just think back to my mom's days when you didn't even know you were pregnant until you were like, 8 weeks. And you didn't get to look on an ultrasound and see a big old clot next to an embryo. So maybe we're like testing too much and we know too much, and that's what's causing all of this stress. But I don't know. I guess I'll just wait to see if I miscarry or the baby grows by next week. So I'll keep you updated. Thanks for watching. So about a month has passed since my last video. Maybe not a month, it's April 30th, 2021 today. No, tomorrow's the 30th. Anyway, I went in for an ultrasound every week. Baby was doing fine until 8 weeks, and then the clot got behind the placenta and like cut off its blood supply, which was really crappy because it was probably totally viable. My doctor did say one thing that's really interesting. She said that I had 2 follicle cysts on each ovary, which a follicle cyst means that you dropped an egg from that side. So she thinks that that hematoma was a gestational sac from a twin that had miscarried at 4 weeks. So it was probably like, had some genetic abnormality that made it miscarry. And then the other twin finally got taken out from that one at 8 weeks. So that was pretty depressing when they finally detected no heartbeat. And that was on like toward the end of March, like March 28th or something. So my doctor prescribed me Cytotec, which I took on April Fool's Day, just by chance. I had to work a couple days, so I waited until I had a few days off. And that was terrible. I never have experienced labor, even though I have a daughter. I had her C-section planned because she was breached, so I never had experienced a labor cramp. And apparently that's kind of what Cytotec does. It causes your uterus to cramp, and some women compare it to labor cramps. So I took it at 8 p.m. when I got home from work. I took a shower, put the Cytotec in intravaginally, and then I went to bed. I took some Tylenol or ibuprofen or something, and I didn't have any problems. But then I woke up in the morning. I was cramping so bad at like 4 o'clock in the morning. So I just sat on the couch. My husband left for work around like 7:30, and the cramping was terrible. About the time that he was getting ready to leave for work, he was like, "Do you want me to stay?" And it finally started to subside. I was taking ibuprofen, Tylenol, like the largest dose I could safely take. And it started to subside, so I was like, no, go to work. And I pretty much just like laid around with my toddler all day. We watched movies, we went to the park. I just like laid in the grass while she played in the sandbox. And then I had really heavy bleeding for like 2 weeks, so I thought everything was good, but it kept going. So now, almost a month later, today's the 29th of April, and I'm still bleeding. So my doc wants to do a D&C, which I'm scheduled for in the morning on April 30th at like 9 a.m. I'm really nervous about the D&C because they have to put you under general anesthesia. And I had a good buddy pass away from general anesthesia only about 6 months ago, and hers was just a minor procedure, but there was some complication during general. And they said her lungs filled up with fluids, and they couldn't bring her back. She died. So I know that doesn't happen, especially not to people in their 30s. I don't know what happened with her. I don't know if she had some underlying condition or if maybe she had taken something that caused a complication. I don't know, but I just keep running through my head, if I don't wake up tomorrow after this procedure. So, like, it's shitty to go through a miscarriage, and like, just thinking about all the possibilities of having a November baby and, the life that I thought I was going to have just a couple months ago is now it's taken 2 months, but I'm accepting that that's not. And like every time I go in for an ultrasound to like check on the clot to see if I've passed everything, even though I know it didn't have a heartbeat like a month ago, I just keep thinking they're gonna find some heartbeat. It's so silly, and I feel so childish having like such unscientific feelings about all of this. But on top of all that, having my friend just pass away from general anesthesia, and now this Cytotec failure, so I have to go under general anesthesia to get everything out. It's just too much. But I have to do it. I don't know any other option. So I'll check back in and let you know how it goes tomorrow. So I made it out of the DNC alive. Woo! General anesthesia went really well. I've never been under general, so I was a little nervous because during my spinal block, my blood pressure dropped to like the 70s. But no complications. I did lose more blood than they were expecting. I think I lost like 500 milliliters, which is like half a liter. It's a lot, but not enough to like warrant me getting blood products or staying in the hospital or anything. Just have to hydrate and rest the next few days. I got the DNC on Friday, April 30th, 2021, and today's May 2nd, so it's been a couple days. Today's Sunday, and I don't work again until Wednesday, so I had a good chunk of time off. My boss gave me a couple days off for bereavement pay, which is really wonderful that my work has that option. So the DNC, I went to the hospital. My husband dropped me off. He had my toddler. We could have had our nanny come over, but I didn't really want my husband sitting at the hospital stressing while I was getting the procedure. I'd just kind of rather, suffer in pain alone. So Alice kind of kept him busy. They went to the park and played, went grocery shopping, and I just stayed at the hospital. I had to get there by like 7 a.m. It was weird because that's what time I get to work, so it's like my hospital, it's where I work, and so I had to get there the same time as all the other nurses walking into work. But, I'm just in my street clothes as a patient. It was odd, but I felt comfortable there because I know the nurses there. I trust them. I sat in the hospital bed until about 8:30, and then they gave me some pre-op meds. They started my IV shortly after I got there and started pumping me full of fluids. I tolerated the fluids much better this time than I did during my C-section. They only gave me a liter, so I'm not sure how much they gave me for my C-section, but I swelled up in my C-section a lot, and this time I did not. It was really tolerable. Like, I needed the hydration this time. Well, they took me back to the OR like 10 to 9. My surgery was scheduled at 9. And then I think they put me like on this table, and they were so sweet. The anesthesiologist was like this skinny little 25-year-old. She was so young. And she just like looked me right in the eyes, and she's like, "We're gonna take excellent care of you. You're in good hands." And just like, as she was pushing, who knows what, or said or something, she said that, and I just like overwhelmingly felt calm and confident. And my doctor was standing there like with her hand on my shoulder, and she's like, "Yeah, this is gonna be okay." And there were some other nurses in there and some techs, and they were wonderful. So, but I don't remember waking up. I remember going to sleep, and I remember like getting onto the table, and then that was overwhelmed emotion. But I don't really remember waking up. I just remember being in recovery, and the nurse was asking me a bunch of questions, like what I wanted to drink, and if I had any pain. And I got like ice chips and cranberry juice, and I think I was talking to her. I don't even know what I was saying, but I felt like I was like in and out of dreamland. I know a lot of people say that they like close their eyes and then they wake up. That's not how it felt to me. It felt like I was stoned. Like I slowly came back to reality. And, they helped me recover, gave me some good pain meds, called my husband. Him and Alice were playing at the park or something, and so they showed up in his big truck, and Alice could just tell, like, I was not right. And she was really worried about me, didn't want to get in her car seat. She's like, I want to see Mama, I want to see Mama. We live like 5 minutes from the hospital, so, she's like, it's okay, just get in the car, you'll see Mama in a minute. And I just kept talking to her the drive home. And then when we did get home, I just felt so stoned. Like I couldn't really talk. I had a hard time walking. I felt really dizzy. I don't know if that was the general or the loss of blood or just being really tired. But I came in the house and I tried to go to the bathroom, and Alice just like came running up to the toilet. And I'm sitting there like trying not to pass out, and she just starts like pulling things off of me. She wanted my hospital bracelet off, and then I had a IV here, so there was tape and gauze, and she did not want this medical stuff on me. She's like ripping the tape off, and she's like, Daddy, get scissors, Mommy can't have this on her. And so he had to cut my hospital bracelet off, and then he helped me to bed, and she was just like laying with me and reading me books and kept handing me water, but I was like kind of in and out of sleepy land, so I wasn't giving her like as much attention as she needed. And I said, so it was like at noon. She goes to bed at noon for a nap. And I said, Alice, you have to go take a nap. Mommy will stay right here on this bed, and I'll be here when you wake up. And she's like, just looked at me and nodded her head like, okay, understand. And so she went and took a nap. And then when she got up, like maybe 30 minutes before she woke up, I just woke up and I felt so hungry. So Luke made me a grilled cheese sandwich, and it was so good. Like had these seeds in the bread that got all toasty in the olive oil. And so I just sat there and ate that. And I think I had a bowl of ice cream too. And then all of a sudden I just felt so much better. I still felt really stoned, like marijuana stoned. Like my brain was foggy, I couldn't think very well. I'd get these like small little panic attacks. Like I would like hear somebody out on the front porch and I'd be like, or like I'd see things out of the corner of my eyes. Like my mind wasn't very trustable. But I just took it easy the rest of the day, kept on the Tylenol and ibuprofen. And then I did not know that my OB was going to do this, but after the procedure, she put like an antibiotic in my vagina and another Cytotec, which I hate Cytotec. It's awful. It gives you the worst laboring cramps. So I remember she said that to me in recovery. Like I wanted to make sure everything was out, so I put another Cytotec in there, and I was like, okay, whatever. But then later when I woke up, I had these terrible cramps, and I was like, why is this hurting so bad? And Luke's like, oh, she said she put another Cytotec, because my doctor called my husband right as the procedure ended. And I was like, what? And she put another Cytotec? And so that lasted like 4 or 5 hours of just severe cramping. It hurts so bad, it makes you want to pass out. Like your whole uterus is just like twisting, cramping. And I bled really heavy for the rest of that day. And then the next day was Saturday. My husband went and bought a canoe because he's obsessed. And so we took that out, and I just laid in the canoe and relaxed while he rowed us around. Rowed? And Alice loved that. So we took it out again today. Today's Sunday. And it's nice to just like hear the birds. It would like row up against this marshy island, and there'd be like carp splashing around. Or catfish, I don't know what they are, with like little blackbirds singing, and it's just so pretty and so peaceful. It's exactly what I need on this like relaxing little vacation from work and life. So it all went well so far. I'm still bleeding, but it's getting much lighter. It's like less than a normal period now. And I probably could have gone to work today, but one thing, last night I had like those postpartum night sweats. Like I woke up drenched in sweat. And I don't know if that's like detaching of the placenta from the uterus causes a hormone shift that causes those night sweats, or maybe like dumping of fluids from IV fluids because I had a C-section. They pumped me with fluids, and then this time they gave me that whole liter. So I'm not really sure what causes those postpartum night sweats, and I didn't realize that a miscarriage would cause them, but I wake up like 1 or 2 in the morning just drenched in sweat, and it just doesn't smell like a good sweat. It doesn't smell like a good workout sweat. It smells like stress sweat or like you've been eating a lot of fast food. Like it smells terrible. It feels terrible. It's 2 o'clock in the morning. I'm cold. I'm wet. This happened when I was postpartum with Alice as well. I remember it very clearly. And I didn't realize it was going to happen from a miscarriage. So that's something to be aware of. You cover your bed in towels or something. I'm thinking to get like a towel bathrobe to sleep in. So you can absorb some of that sweat, because it's an awful feeling to wake up cold and wet like that. But yeah, I'm really glad I went through the procedure. I really didn't have a choice. My OB was like, it's been, heartbeat stopped over a month ago. Like, you have to get the rest of the stuff out. The placenta's not letting go. The Cytotec failed. I didn't have any choice but a DNC. So I don't recommend one. They're pretty terrible. General anesthesia is always a little scary. But I'm glad I have the option, because otherwise it could have gotten infected and gotten in my bloodstream. Who knows how that would have ended up. Hopefully we can start trying again. I think we're going to wait a little bit because we have a big trip planned out of the country in February, so I don't want to be like 9 months pregnant in February, and it's currently May. So I think we're going to wait until like July so I can be like 7 months pregnant for that trip in February. So a couple months we're going to hold off on making a baby and try again in July. So I'll do a video update then. Thanks for watching. Okay, it's now July 29th, I think, and we are trying to conceive this month. I'm like on cycle day 9, I think, today, so I should ovulate in just a few days. So I've been tracking with ovulation predictor kits. Still pretty faint lines. I did order a basal body temperature thermometer, and I have been tracking cervical mucus this month as well. So hopefully my next video will be first trimester update, if all goes well this month. Miscarriage is terrible. Do not recommend that. Hopefully I never go through that again. And if I do, hopefully I pass it naturally and don't have to get a DNC, because although the DNC went smoothly, I do not want to go through that again. So send me some baby dust, and thanks for watching. Just real quick, Alice wanted to say hi. You want to say hi? Can you say hi? Say the word hi. Hi.